where we explore the latest in health across the country. I'm Erica Cardenas. In today's show, we're talking about brain injury awareness. Every 23 seconds, someone in the U.S. sustains a traumatic brain injury. So we're sharing some prevention measures you should know. But first, let's take a look at what's coming up on the show. Help with breathing issues after a COVID diagnosis. And if you can't get a good night's sleep, we have a solution for you. Plus pain treatments for everything from migraines to joints. All that and more coming up on Your Health. We're here at the Brain Injury Alliance of Arizona to talk about Brain Injury Awareness Month, and joining us now is certified brain injury specialist Will Grove. Will, thanks so much for being with us.
Thank you so much for having me.
First off, what is the mission of the Brain Injury Alliance of Arizona?
So the Brain Injury Alliance of Arizona is the only statewide nonprofit that works with survivors of any type of brain injury anywhere in Arizona at any stage post-injury, but also with their family members, their caregivers, any member of their support system as well. And we also do a lot of work in the community, helping to create awareness within the general public for prevention as well.
What is the most common type of brain injury?
The most common type would fall under the category of traumatic brain injury, which is a bump or a blow or a jolt to the head. Here in Arizona, the most common one of those comes from falls. Though certainly car accidents are a big cause, assaults, and also athletic injuries, and a lot of other different factors contribute to the amount of brain injuries here.
So, Will, what is one of the biggest misconceptions that you find when it comes to brain injuries?
I would say the biggest misconception is that if you can't see it, it's not there. We often refer to invisible scars, invisible injuries. So you'll have an individual who's maybe not exhibiting any physical symptoms, maybe quote unquote looks fine, but is still dealing with a lot of cognitive issues as a result of an injury that may have been years ago. And I think sometimes it's difficult for our survivors to get that understanding of the injury that they're still dealing with, recovering from.
So, Will, how prevalent are brain injuries?
So here in Arizona, there is a brain injury incident more than 65,000 times a year. That's resulting in over 8,000 hospitalizations on a daily basis. And that's just right here in Arizona. Nationally, the figures are much higher. And a caveat that I'll add to just about any of these figures of brain injury is they're all underreported. So those figures I can give, that's what we're able to count. It's actually much more prevalent because people don't know to seek treatment or don't even recognize that they've had an injury.
Are traumatic brain injuries preventable?
Absolutely. Certainly not 100%, but there are a lot of different precautions one can take. The one easy one, wear a helmet if you're participating in motorcycling, bicycling, really any sport that you'd expect to have that. Wearing a helmet's a big part of it, but also when it comes to driving or operating a vehicle, make sure that you are in the right mindset, make sure you're not distracted.
Now, you all provide an abundance of resources here at the Brain Injury Alliance of Arizona. Tell us about some of those.
So one of our big day-to-day ones is our resource line. Through our resource line, we can help people access vetted resources anywhere in the state of Arizona, whether that's different clinical specialists, whether that's different community providers helping with food or housing. And then ourselves, we provide specific resources for veterans and survivors of drunk and distracted driving incidents, and our own support groups, which are completely free in different classes and programs.
Now, Will, of course, you all are a nonprofit, so you have something very special coming up. Tell us about that.
We do. We have one of our biggest fundraisers of the year coming up at the end of March. It's on March 25th. It's a fun run. It's called Run, Walk, and Roll. It is a 1-mile fun run, 5K or 10K if you're ambitious. But it's one of our biggest fundraisers that's going to go to supporting our rec therapy program and creating a lot of social opportunities for our survivors.
Will, thank you so much for being with us. We appreciate you. If you'd like more information about brain injury awareness and prevention, just head over to the website. Getting a good night's sleep is important to our overall health, but issues like acid reflux or pain can interfere with the restful sleep. The experts at MedCline have a sleep system to address these issues and allow you to sleep comfortably.
For many consumers, sleeping at night should be an easy experience. For many, it's not. There are a number of reasons for that, most notably those that suffer from acid reflux or heartburn. There are also many individuals dealing with various pains or ailments, shoulder pain, back pain, which can prevent a restful night's sleep. MedCline is a sleep solution company. with our goal to allow people to have a healthy and peaceful night's sleep. And we do that with our therapeutic side sleeping systems. Our patented, clinically studied Medcline relief systems are designed to place an adult in an elevated side sleeping position, which can help them reduce the symptoms or issues they're dealing with.
It took maybe a couple nights to get used to the shape and feel of the product, but since then I've had no back pain, no neck pain, and no issues with my acid reflux keeping me awake.
Medcline systems comprise 3 components: an elevated wedge, an insert pillow allowing for comfort of the head, and a full-length body pillow. That body pillow is very important because it allows for a patient to stay on their side throughout the night, allows them to easily switch sides, and most notably allows them to stay elevated on the bed wedge without sliding down during the middle of the night.
When I go to bed at night, I don't get sick anymore. I don't slide off the pillow. It's large enough where I don't slide down.
The Medcline Reflex Relief System has been clinically studied. We have published to date 8 clinical studies, most notably in partnership with the Cleveland Sleep Clinic. And those have shown statistical significance of a benefit of using the Medcline sleep system to help reduce overall nocturnal reflux.
Now that I have the Medcline, I can sleep through the night. I don't get up and have those gaps. And
you don't have to worry about taking medication and all of the side effects that go along with that.
Given the success of our reflex relief system, we noticed that patients were purchasing Medcline systems for reasons beyond heartburn and acid reflux. We then specifically developed a system unique for those suffering from shoulder pain.
And now I can put my arm underneath and have my head up here and I get no pressure on my shoulder. And I wake up and I'm like, all right, I'm not hurting anymore.
Medcline systems are registered with the FDA as a medical device. And as a medical product, Medcline systems are qualified for use with FSA and HSA funds, which is a common way that many of our customers purchase Medcline systems. For anyone looking for more information, you can visit medcline.com/sleepbetter.
Caring for someone who is a brain injury survivor can be challenging, but there is help and support for families. Check in with your local Brain Injury Alliance to see their available resources. Stick around, there's more to come on Your Health. Getting your child the dental health care they need and the difference rehab can make for those with pulmonary disease. Going to the dentist can be scary for kids, but not when your dentist specializes in pediatric dentistry. It's their job to start children off right when it comes to dental health.
Welcome to Quest Pediatric Dentistry and Orthodontics. Here at Quest, we pride ourselves on serving the children of Acadiana. We start in infancy all the way through 18 years of age.
What is that?
Right, can you smile and show her your teeth?
Can you show me what it is?
So we really try to start off on the right foot, make them more comfortable, educate parents on better oral habits, dietary habits, things that can make their child's dental lifestyle better.
As an orthodontist here at Quest, we provide a multitude of services to allow you to transform and straighten your smile into the smile of your dreams.
Here we also serve all of the child's dental needs. And what I mean by that, from fillings, extractions, but also too, children are growing, unlike adults and stuff, so things are changing. We also offer orthodontics, so growth modification, to where we can assist them in basically in their growing needs as they mature and become young adults.
It's truly gratifying to see these young children join our practice and watch them grow into young adults, especially a child coming in nervous for the first time, and then watching them blossom into a confident young child.
So from the moment that our patients walk in the door, we have wonderful staff that greets and welcomes them and checks them in, and then they're able to come and have fun and play on our pirate ship and a few of our little games in the back while they're waiting for their appointment to be ready.
The atmosphere, again, is warm and welcoming, very kid-friendly, parent-friendly. They make sure you feel calm. They explain everything to you. They're patient.
I really love interacting with all the patients and their families. We see them, very frequently, every monthly, and it allows me to build a relationship with both the families and their children.
I love everything about this place from the moment you walk in through the door and you're greeted like family, through the way this place looks. It's so warm and so welcome and so inviting.
My favorite part is working with children because I know everything is connected and it starts at the mouth. We're going to educate the parent and the child on brushing, hygiene, foods that are good for the teeth, foods that are bad for the teeth, all of those things.
I truly feel like our office is set apart from the rest. The compassion that the doctors have, and not only the doctors but our entire team, from the moment that you walk into the office till the time you leave, you will be treated with kindness and compassion.
Pulmonary disease can cause severe breathing issues in patients, but with pulmonary rehab, these patients can be helped immensely. The experts at La Mesa Rehab show us how.
Breathing is essential to life. If you can't breathe, it's stressful. Your body, your brain understands that you're not getting the air that you need, and it goes into stress mode, which is fight or fight.
Chronic obstructive pulmonary disease, COPD, is a group of diseases which includes emphysema, chronic bronchitis, and chronic asthma. In addition, you may have combinations of each of these diseases, which makes the group total to 9 different categories of diseases.
It can be genetic that you get from your family, but more commonly it's an acquired disease, most commonly associated with smoking.
The mainstay of treatment of chronic obstructive pulmonary disease is an assessment by a competent physician or pulmonologist with referral to a pulmonary rehabilitation program.
I truly believe in pulmonary rehab. And it has a huge effect on preventing progression of the disease. So it gives my patients the knowledge to have better control of the disease.
I'm a firm believer in pulmonary rehab and its essential role in the treatment of any patient with any kind of lung disease. I was overjoyed to find out that there was a program in La Mesa. Just having a program in East County has been a godsend, literally. I've been so impressed with just how much your staff cares about each individual patient. No one ever hugs me after I give them an inhaler, but I get hugs after I send people to pulmonary rehab, and especially La Mesa Pulmonary Rehab.
Wow. The best part of coming to La Mesa Rehab for pulmonary therapy is that I've got my life back again, and this is part of my life. I wasn't even able to feed him before I got to La Mesa Rehab, and now I'm able to walk him up and down the stairs, and it's just been a wonderful experience for me.
Now I can walk on the hillside. My breathing is much better.
They smile, they laugh, they rediscover the joy of living. So less than 3% of patients in the United States with COPD get pulmonary rehab. It's a huge problem, and one that pulmonologists and our professional organizations are trying to address. Many voices create a loud noise, so it's really imperative that people talk about this and talk about it to their friends, to their neighbors, and just start getting people engaged.
People ask me why I'm so passionate about pulmonary rehab. My own father died at the age of 72 from emphysema. I know we could have increased his lifespan by another 10 to 15 years if he had had access to a program like this. Pulmonary rehab is life-saving, and I want to bring this program to as many people as possible.
Don't go away, we have more Your Health coming up. A customized dental care system for your kids, and treatments for pain in all areas of your body.
Your Health is brought to you by La Mesa Rehab, improving the lives of those with all types of lung disease and long COVID symptoms.
The Super Dentist has been a leader in pediatric dentistry, and now their co-founder has created a custom mouth care system for kids.
The #1 disease in the world, according to World Health Organization, is dental disease. The #1 chronic disease in children is dental disease. For 25 years, we've had one of the most leading group dental practices in the country, and I've been asked the same questions by parents. So I decided to write a book about it to explain how oral health connects to physical health and mental health and every part of a child's life. But also, we have to provide a solution. Imagine you're a parent, you're a mom or a dad, and you have a 2-year-old that doesn't get any cavities, and you have a 12-year-old that has a soda habit and gets a ton of cavities. Well, how do you determine what oral care products to get? It's really mind-boggling that currently there does not exist an oral care product company that specializes for kids. So we thought this is a great opportunity to get into that space and revolutionize oral care for kids. We have every single product that every parent needs for every person in that family. It's very comprehensive, from toothpaste to mouthwash and from floss to toothbrushes, and from all the other oral care products that every person needs from all the developmental stages of life. And we divide it into 5 stages: during pregnancy, birth to 2, when the baby teeth are coming in and the oral microbiome is evolving and maturing, 2 to 5, when we have the primary dentition, from 6 to 12 is when you get your permanent teeth and your baby teeth are lost, and then from 13 plus, the teens and adults. The next thing is we customize the oral care products. Someone who has a lot of gum disease probably requires different sets of oral care products that someone has a very, very healthy mouth. We conveniently have a questionnaire, a profile builder on our website. So you go as a parent, you answer a few questions, and then we customize those products specifically for your children. And it's also conveniently shipped to your home every 3 to 6 months, so your children and your family will never run out of the products, and you will have all the right products at the right time. Every oral care product you put in your mouth and the mouths of your children obviously need to follow a few things. One is they need to be safe, right? Because needless to say, everything that goes in our mouths get absorbed through our mucosal tissues, the soft tissues in the mouth, and of course we swallow some of it. Next, they need to be unified. They need to work together as a system and complement each other. The next one is we want them to be playful and fun, because especially for kids, we want to build positive associations with their mouth and their oral care. Next, they need to be effective, right? And of course, when it comes to health, usually all the ingredients and the drugs in the market are either safe or effective, but we want to provide products that are safe and effective at the same time. And lastly, they need to be from a reputable source. All of our oral care products were developed by world-class pediatric dentists and medical experts. We also have a ton of educational content for parents and the doctors. So if you're a family and you want to learn about Supermouth, you want to learn about the oral care and how it impacts your children's lives and your own family, make sure you go to supermouth.com and check out all the educational content, and of course check out our profile builder to get the right products for every family member.
Stick around, there's more coming up on Your Health. Ways to fight pain from migraines to your joints.
Your Health is brought to you by Supermouth, custom mouth care systems.
Whether it's knee pain, migraines, or anxiety, the doctors at Anodyne Pain and Wellness Solutions take the time to understand your health journey and create a path to overall healing.
Hi, I'm Susie from Anodyne of Las Vegas. I'm a co-owner of this integrated practice. We have medical care and chiropractic care. We also have some natural healing therapies, such as red light therapy, a hyperbaric oxygen chamber. We've got some amazing chiropractors. Our medical doctor helps treat joint pain. We don't prescribe pills or encourage surgery. Our athletes love it here too because they get IV hydration. They get to cool the inflammation in their body with red light and hyperbaric. We also help patients with their sexual wellness needs. Anodyne is unique because we're an integrated clinic. We're a one-stop shop. Patients come here and they get to experience different types of treatments, and they don't have to run across town looking for, this type of practitioner, that type of practitioner. We help them here.
It all starts with our first initial exam,
We go over thoroughly what the complaint area is and in general health and how the general health has complicated the complaint area. We don't just treat for one place. We treat each person as a whole. Pain from disc injuries, pain from muscle injuries, pain from ligamentous connective tissue injuries. Basically, that's what we do.
There's a group of friends of mine, ladies, that we all go to the gym together. And one of them is quite sick. She recovered from cancer. And she started talking about this red light therapy. It's basically you climb into, it looks like a sunbed. You know, it's comfortable, it's very soothing. I feel it kind of just gives me a little energy. I just find it's very easy, very convenient, and it's 15 minutes of my time.
We want to help patients live the best life they can. And with these natural healing therapies and the different modalities, our providers collaborate on a patient to be able to get to the root cause of their pain and prescribe the best customized treatment for the patients.
I've done a few. I've done the IV rehydration. It was awesome. You know, we live in the desert. I don't drink enough water. You feel rejuvenated afterwards. The red light therapy, 15 minutes. You know, I can come down here on my lunch. You know, I feel helps with some inflammation. I've got, you know, the beginnings of some arthritis, and it's kind of your one-stop shop down here. I've, you know, talked to them a little bit about everything, and so I'm slowly working my way around.
When their family and friends come and tell us, so-and-so said to come see, you know, Dr. Sadeghi or Dr. Moran, Dr. Lukens, Tammy, our physician assistant, and that is the best feedback we can get. When they want to share the care that we provide, the best feeling in the world.
We want to thank everyone here at the Brain Injury Alliance of Arizona for hosting us today, and thank you for joining us on Your Health. We hope you have a happy and healthy day. I'm Erica Cardenas. See you next time.